Good afternoon, everybody. Welcome back to our afternoon session. Encourage those that are coming to take their seats to go as quickly as possible. We can get going. Give it a few more seconds. Okay, in the interest of time, I'm going to kick off and hopefully everybody can hear me as you gather your seats. So thank you very much for joining us for this afternoon session. So we're turning our attention now to our global partners. And I'm really delighted to welcome Merran and Mingshi, who have kindly joined us in Leeds, all the way from Australia and Singapore, and have just about recovered from their jet lag, hopefully. So just to do some quick intros. Merran is the Chief Executive of Australia's Population Health Research Network, a national research infrastructure focused on linkage of health and other human services data across the whole of the Australian population. She has an extensive background and many years' experience in Australia's health and research infrastructure systems, and she is the past director of the International Population Data Linkage Network, which I'm sure many of you know, and is a current member of the IPDLN Executive Committee. And we have Mingshi joining us from Singapore, where she's currently the Director of the Trust Office under the Ministry of Health Office for Healthcare Transformation. The office oversees the running and continued development of National Data Linkage and Exchange Trust Platform, and also supports the development of national research, innovation and enterprise health data initiatives. So in our quest to accelerate trustworthy data use, and enable discoveries that improve people's lives, I think one thing that we all know for sure is that there is still a lot to learn. So I'm really looking forward to this session where we will hear from both Merran and Mingshi and how we can collectively work in partnership to really push forward health data science. So we'll start off with two talks, initially for Merran and then Mingshi, and then we should have a good time for discussion at the end. So may I welcome you to your talk, Merran.
Well, thanks, Ros, for that nice introduction. And I must say it's lovely to be back in the UK. It's been great to catch up with some colleagues already today. But it's also been good because, as some of you may know, Western Australia, where I'm from, has had the hottest summer on record. And February was particularly hot, with most days in the high 30s and some in the 40s. So it's lovely to have some early English spring. So today I want to give you a perspective on some grand challenges for health data in Australia. And I just want to cover, first of all, the health data landscape in Australia, because it's a little bit different. There are similarities, but some significant differences from the UK. Then talk about some of the key challenges that we have and some of our responses, and then finish by saying something about the future. So to start with, a little bit about Australia. It's a big country, a big island. We're about 22 times bigger than the UK, and we've got a population of 27 million, which is about 2.5 times smaller than the UK. We have a federated structure. We have a national government, 6 state governments, and 2 territory governments. And we have a federated health system with the Commonwealth states and territories all having a role in the provision of healthcare. And we also have a significant private sector, with about 40% of hospital admissions through private hospitals or not-for-profits. So then, health data. We have some good national health data. We have a Commonwealth Government agency called the Australian Institute of Health and Welfare that holds national health data, including hospitalisations, cancer registries and deaths, and also data on primary care and prescribing. Then the states and territories have more granular data, and they actually provide subsets of that data through to the Institute of Health and Welfare, which is how they put together that national data. And then of course we have registries. Universities and research institutes have registries and or big clinical registries and large cohort studies. And then there's the Population Health Research Network, my organisation, PHRN for short, and we're involved with linking data across all that health data, linking at the individual person level across the whole population. And this is complicated because we don't have a national health system, as I've said, and we don't have an NHS number that we can use. So the PHRN has supported data linkage units within the Australian government at the Institute of Health and Welfare and in each of the 6 states. The 2 territories are a bit too small to have their own linkage unit. So the Northern Territory, the big one in the middle there, partners with South Australia in the south, and the Australian Capital Territory partners with New South Wales. So that way we have all the data in the country linked. And we've also supported a secure research environment. Sometimes you tend to use the term trusted research environment. We tend to say secure research environment. And we have one that works for any university or research group. At the Sachs Institute in Sydney, it's called SURE, the Secure Research Environment. We also have an online application system, and we have some other e-research tools. So then, grand challenges in health data. Well, I've started off with ELSI, and I'm not sure if you're all familiar with that term, but by that I mean ethics, legal and social implications. Data management, user access, workforce and changing demand. And I'll just work through each of those one by one. So the first one is ELSI. And there's a number of challenges. We have challenges around the ethics of AI projects. We have complex legislation framework, and we have changing community views. So it's really important to keep in touch with how the community thinks. For example, when there have been major cybersecurity incidents in Australia, then the community may get a bit more anxious about how its healthcare is and its healthcare data is managed. And also in Australia, we have data sovereignty. So we have a large Indigenous population, and Indigenous data sovereignty is an emerging issue and a challenge. So some of our responses: law reform, that takes time, it's complex, but sometimes necessary. And then ongoing patient and public engagement. And I've just put a link there to a recent citizens' jury that we ran around the use of general practice data. And we were a little surprised that our community generally feels a bit different about use of general practice data than it does through use of other health data. And there probably is something there, but the GP services in Australia are organised in a way that's slightly different from in the UK. So what we find in our citizens' juries may not necessarily apply in the UK. But if you're interested in that, there's a link there to the paper. The next grand challenge I've listed is data management and common approaches or lack of common approaches to metadata and data standards. Data linkage and integration can still be an issue. And then fair data, which we've heard about already today, and also care. Our responses: metadata platform. We've just launched a big metadata platform, and I know HDR UK has got some great metadata, so that may be of interest to some of you. We have a national master linkage key. That's to do routine linkage between the Commonwealth and the state and territory data, which is sort of like doing routine linkage, I think, between Northern Ireland, Scotland, Wales and English data. And we're also having more linked data assets so people want a linked data set, it's already linked and they can just access it as opposed to having to do linkage. So in some cases you do need to do special linkage, but not in every case. The next one is user access. So we've heard this morning that it can be complex, and it can be complex in Australia as well, particularly for cross-jurisdiction linked data. And the cost and demand for secure research environments or trusted research environments is also a challenge. In terms of responses, we've got the online application system that I mentioned. We've got almost 800 registered users of that. We have client services staff in each of the linkage units to help researchers access the data. And we're also investing in secure research environments. We've got the SURE facility that I mentioned. But interestingly, some of the big organisations in Australia are increasingly moving to an Microsoft Azure solution or Amazon Web Services. just as an aside, in Australia, I'd quite like to see a trusted research environment in each jurisdiction, and a number of the jurisdictions now have set up their own environment, rather than having numerous environments across the country. I think if we can sort of simplify the trusted research environment landscape, it will probably be better for everyone. So then workforce, it's been mentioned once or twice today, but not a lot. So skills gaps in data science and analytics, staff recruitment and retention, particularly if you want an AWS developer, and then the cost of skilled staff. Again, the cost of people with AWS skills in Australia is significantly above what is the usual rate. In terms of responses, I've mentioned there a position paper about research infrastructure, and that is around trying to get universities and employees to recognise that research infrastructure is a calling and that there needs to be a career progression pathway in that. And this was a paper by Australian research infrastructures, not just in health, but in other areas, including astronomy and microscopy, marine science. Shared positions and on the job and other training. And then changing demand, that is something that we're seeing, and it sounds like you're also seeing it in the UK, which is steady growth in demand for linked data, demand for linkages of all data types, including the omics, imaging, and clinical data, and also demand related to international studies. I've put that as a challenge, but I think it's also an opportunity, and we've already heard today about the multinational studies for COVID, which I think is really important. In terms of responses, one thing that Australia's done which may be of interest is we have separate national research infrastructures for omics, imaging, and several other areas, and we are now meeting as a research infrastructure group. So I think that's one response, and the other is greater international collaboration within national research infrastructures and also for research. So just to say a little bit about the NCRIS Health Group ecosystem, and it includes PHRN, bioplatforms, which has the genomics information, the National Imaging Facility, phenomics and therapeutic innovation. And the CEOs of these infrastructures meet monthly to help coordinate access to that infrastructure. We've supported successful grant applications, and we're also working on international collaborations, both at the individual research infrastructure level and then at the research infrastructure ecosystem level. And we've mentioned the International Population Data Linkage Network that most of you, I think, will be familiar with, which is an example of good cooperation within the health sector. But there's also been meetings between Australian infrastructures and European infrastructures. There was a meeting in Italy in 2023, and there's another meeting, an international conference on research infrastructures in Brisbane in December 2024, which will also have a health research infrastructure ecosystem satellite meeting. So these collaborations, I think, are increasingly important. And then just an impact story. It's probably a work in progress, but the Australian Brain Cancer Data Bank. So these 5 research infrastructures work together to advise the people putting together a funding proposal. And as a result of that interaction, I think the funding proposal that went forward was better and it was successful. And this Brain Cancer Biobank will be looking at new platforms to improve patient outcomes and finding a cure for brain cancer. So then, looking ahead, just a few comments. Continuing to address the health data challenges that we've talked about. Be alert to emerging issues. So we haven't said too much about cybersecurity so far. That may come up tomorrow, but it's something that I think we all need to be alert to. And the other challenge is re-identification of data. So as there's more health data, people's health data is around, we see there being additional risks that need to be managed. And then last but not least, I think we will be fostering greater collaboration at research infrastructure levels as well as within the health level. And so, in summary, health data's a journey. We've heard a little bit about that today. It's a destination. I don't know if we'll ever arrive, but we need to keep working in that direction. There are challenges, but progress is being made. And I think last but not least, we need to keep in mind that all the effort we put in every day with health data is leading to more evidence-based care and healthier communities, better outcomes for everyone. Thank you.
Thanks, Merran.
Can you hear me all right? Yeah. Thank you for inviting us to share about our health data journey. And I'm very pleased to be here and to also hear from the experience and learn from the experience that all of you have. My name is Mingshi. I'm from Singapore, from the Ministry of Health, Healthcare Transformation Office. And we are leading the Trust platform, the equivalent of a TRE in Singapore. Singapore is small, so we only have one. And this is the Trusted Research Network equivalent that we have established. When Andrew and Rhoswyn asked me to talk about our health data challenges, I thought about these 3 pictures and they really reflected our journey. Health data sharing analytics is challenging, it's hard. And it often feels like we are trying to push this boulder up the hill and just making sure it doesn't fall back on us. But we reckon that really if it's easy, somebody else would have done it already. I think the other thing we've learned about health data is that it's really multifaceted and multidimensional. Merran had talked about it. You realize that every day you're just dealing with multiple issues, ethics, legal, regulatory, technical, and it feels a bit like you're trying to pitch a tent in a storm, right? Trying to make sure that you get all the pegs into the ground. And trying to do this alone is pretty impossible, and getting the right partners really makes all the difference. And I thought, really, at the end of the day, for us, after doing all that, and you've conquered the first hill, and you realize the value you've created, and the scenery is truly inspiring, and then you start thinking about what's the next mountain that you want to start conquering. And I thought that really kind of summarizes our journey. And so, actually, I've finished my talk, but if you want to hear the boring bits, then this is what I'm going to share today. The key health-related data challenges that we face in Singapore. I'm sorry, Rhoswyn, I changed the topic, the exam question a bit, because I thought health data in itself does not really reflect what we're doing. It's really health and health-related data. How we're trying to enable safe and efficient data linkage and analytics through Trust, the national data sharing and analytics platform. And really, what is the next bound for us, and where we think a lot of opportunities for collaborations will lie with many of you in the audience. So a little bit about Singapore. Very small country, less than 300 square miles, so that's about half the size of Greater London. Less than 6 million population, of which about 70% are residents. Public healthcare is served primarily by 3 national healthcare clusters, and interesting to note that 80% of our acute care is served by public hospitals, and 80% of primary care is served by the private sector. So a little bit about the way in which we organize health and health-related data in Singapore and the landscape. The respective ministries and agencies are appointed as the single source of truth for the data that they're responsible for. So for example, the health ministry would be responsible for the health data as custodians. The education ministry, likewise, for education types of data. Research and cohort data are managed by their respective research institutes, universities, public hospitals, and as a result of that, as you can imagine, that will be resulting in different data access governance, different data access rules. And I think largely there are 2 types of interesting research data out there for us, population cohorts, as well as disease-specific clinical domain cohorts. So this slide really summarizes the, I guess, top 3. There are many much more challenges, but this really summarizes the top 3 for us. And it has led to really limited data-driven innovation and insights. So I'm going to spend my next few minutes talking about how we've been addressing them and what we've been doing so far. So the first challenge really around unclear data access rules. As I mentioned, different data custodians means different data access controls and rules in place. And it is further compounded by different interpretation of the laws governing the use. And that has translated into very lengthy negotiations that our researchers have to go through when they are trying to navigate this, trying to get access to real-world data, research data sets. And what we've done through the Trust platform was to look through and clarify really the permissibility of use of the data sets and to understand what are the data that can or cannot be used in the broader ecosystem and develop pre-agreements with the different data custodians. So we agree with them up front how their data can be used and then what condition and what are the permissibility rules and governing laws that allows for that. And then we codify them into a set of principles of sharing. And these principles are then upheld by a central data access committee that's been appointed. And so as a researcher now, what it means is that if you want to access housing data, socioeconomic data to be linked to your research data, you basically go through one portal, one committee to get that access approved. The second challenge we faced was around varied data security and access practices. There really wasn't a central platform that allows for different custodians to bring their data together for analysis in a secure manner. And what we've developed with a lot of our partners in Singapore is a national data exchange platform, Trust. And it is hosted on the government commercial cloud, AWS, which allows for data fusion, linkage, and analysis to be carried out. And we've also served as a trusted third party to allow for the linkages to take place. The third challenge is around data standards. And we spent this morning, thanks to some HDR UK colleagues as well, sharing about our experience. Really with varied data standards, while it doesn't really matter to the data custodians themselves who are very familiar with the data, but unfortunately it makes data sharing very difficult across different users and across different jurisdictions as well. And data cleaning in itself is also a resource-intensive effort, as we've learned. What we've tried to do to improve interoperability and discoverability of the data is to adopt agreed standard for, at least for our clinical data, MOHT. And we have established central data curation team for both clinical data and research data with the aim of being able to build up a pool of trained data engineers who can do this at scale and be able to bring their knowledge across different data cohorts to be able to do this. Of course, with the establishment of the catalog, it has also increased the visibility of the different types of data that I've talked about. So essentially, Trust enables us to have a more efficient and secure way of accessing different types of data sets and to improve, through that, to improve health outcomes. We allow for different data sets across custodians, across sectors to be brought together and analyzed in an anonymized manner through a combination of policies, technical solutionings, as well as legal frameworks. We've adopted the 5 Saves framework. Thanks for sharing that with us. And it's been very useful in helping us to think about and organize the different types of perceived ways of managing the data, and really balances the privacy and private and the interest of public interest with the safe use of the data itself. So as compared to many of the TREs, we are really a baby in the room. Went operational last year, and we are now expanding the type of data sets and the use cases that's available. We're going to be piloting access by industry this year as well. And we hope to continuously be in the forefront in testing and validating many of the new technology solutions in order for us to really bring ourselves to the next bound of being able to do this at scale. We're very encouraged by the building of the user base and also the range of use cases that we have been supporting on the portal itself. And I think very important for us is really building up the impact narratives. I think that's a very important way to demonstrate the value of doing this to the funders, to the public as well. And we're really excited that, even though we've just been doing this for a year, we have managed to do some of this national level analysis across different custodians, data owners. One example is to look at identifying and validating genomic risk factors for severe COVID-19 patients, and also supporting our national precision medicine program by being able to bring together large-scale data sets across the population, ranging from phenotypic to genomic data sets to real-world data sets. And I think this is probably a good slide for us to end off with. I think going forward for us, it's really about how we can increase impact, how can we increase the interoperability, and also how do we enhance our user experience. And there are a lot of things that we want to learn from all of you. I think importantly for us, being able to go beyond structured data to unstructured data, being able to support a wider range of users is important. Being able to interoperate with local and international TREs is also the next bound for us. And adopting new technical solutions to do that is definitely important as well. We really prioritize enhancing user experience to make sure that we can address and help the success of our researchers. And some of the things that we'd be very keen to learn from the audience as well is when it comes to scaling and getting ready for a lot more use cases that is going to be brought in, how do we better automate the way that we are doing checkings, approvals, and also to have a chance for us to interact more with our users through training programs, academies that can help to uplift the literacy and also the understanding of data governance and data management as a community together with our researchers. Just a slide to show who we are. These are really the magicians behind the scene who has made all this possible. I've got some of my colleagues here with me today as well. And just a slide to say thank you for your time, and we're very pleased to take any questions. Thank you.
Great, so I can't see any questions coming online yet. So while maybe people are thinking of their questions, please do put your hand up and the roving mics will come. I might take Chair's prerogative. I can see 2 quick hands already. And just open with one initial question. You both touched on the challenges of opening up data access. So that's something that all of us are really striving to achieve. And as you've both pointed out, it takes many moving parts to bring it together. If there was one thing that you've seen really kind of transform or push things forward in a positive way, what would it be? So Merran, do you want to?
Probably from my point of view, it's to simplify and standardise the data access request form. We had a project in Australia called SODA, Single Online Data Application Form. We haven't finished that project yet. It's sort of quite complicated and people feel a great deal of ownership about the particular application form that they have. But if you actually look at these application forms across our country, 80%, at least 80%, and probably 90% of them are actually the same. And the actual item may be called something slightly different, but really it's the same. And to try and move everybody to a standardised form, I think would be enormously valuable. There's perhaps one other thing that I might say, is that when we look at the time taken to actually access a linked data set, time is often spent with the researcher. So there's some time spent with actually the data custodian considering the application. There's a little bit of time spent with an ethics committee considering that aspect. But then there's time spent with the researcher, and there may be a question that the ethics committee has, and it may then go into a loop with the researcher who may be busy doing something else. Mm-hmm. So the other thing we've done is provided a training some training modules to help train researchers, so to help researchers know what is the short pathway through this sort of complexity. And those two things, I think, are really important.
Great, yeah. Resonate with a lot of work of the team, actually, on that thing. Mingshi.
Yeah. Actually, it's not different. I think a lot of us face the same challenges. I think one of the key difference for us really is getting the different data custodians, especially the real-world data, to appreciate and understand the need to do this and why we're doing this. I think what is the value to create this? And really, the only way to do this is to get started, develop some real projects to demonstrate why what is the value that we're generating. I think that really allows us to take the first step and to be able to do much more.
Kathy, you were quick with your hand up.
Yeah, thank you both. It was really brilliant. And so many of those challenges are familiar to us in the UK, and I'm sure very many people sitting around the audience are thinking, oh, yeah, we have that too. So I wondered if you came across the challenge of, and if so, how you are sorting it out, of what I might call data territorialism. So people sort of hanging on to their data and being somewhat reluctant to do this thing that I think we all see massive value in, either because it's important for their research competitive edge, or perhaps for some kind of either perceived or real financial or even political competitive edge. Is that an issue that you've encountered, and how have you dealt with it? And that's a question for both of you.
I think it's definitely an issue. I don't think we've dealt with it in any substantive way. There are probably a number of sort of elements or ways to begin to unpick that problem. And one is around what's in it for the data holder. So if the data holder's put together a very important data set, they've worked for years to get it together, and then somebody wants to access it, what's in it for that person? Are they going to get recognition for everything they've done? Are they going to be involved in perhaps a publication? So I think probably there may be opportunities to try and incentivise that, to provide some benefits back to the holder of that data, because otherwise I think a lot of people will talk about fair data. I think we all agree and believe in it, but I think what you're talking about is the practical difficulty of making it fair. If anything, I think that data sets are gradually data is becoming more open, and people are becoming sort of socialised to the concept of fair data. And I think that going forward it will become more common, and perhaps in 10 years' time it will be the norm. But I think at the moment it's definitely not, and I haven't got a silver bullet, I'm sorry.
Well, I guess in Singapore, no such thing. We're all happy sharing data. Of course, that's nonsense. That doesn't happen anywhere. What we've done is really to understand what the concerns are from the data custodian's point of view. There's far-ranging reasons for that, and very often it is really about how can they continue to use their data sets in a manner that's meaningful to them. I talked about the pre-agreements that we've established with our data contributors. So for example, with the research contributors, a lot of them which are publicly funded, what we have done is to allow for them to have priority access to the trust platform. They can do their linkages, carry out the analysis for an agreed period of time. So they get exclusive use, for example, of their own data sets. They can bring in partners if they wish to, but that gives them the head start, that gives them the exclusive use for a specific period, beyond which they will agree to open that data set up to a wider group of users. So that's what we are trying. Invite me back next year, I'll tell you if it works.
We may well do. Great, I saw a hand with back. Yeah.
Hi, Claire Harrison, Chief Digital and Technology Officer at MHRA. So I have a question that's similar to Kathy's, actually. We've not rehearsed it, we've never met. Mm-hmm. But my question is around the culture of Australia and Singapore, the questions to both of you. Not so much from data custodians, but from citizens. So is there an expectation and positivity around data sharing, or is it, and I guess the two aren't mutually exclusive, or is there suspicion and worry about potential data linkage and sharing, and how do you mitigate any of those? Thank you. And I should say, I should say as a technologist, sometimes, don't tell anyone this, I think the technology is the easy bit. It's those things that we've been describing, culture and sort of territory, I think are the hardest ones, the things to overcome.
Yeah, Mingshi, do you want me to go? Okay. I did mention about the engagement with the public and citizens jury. We do this through our research programs, for example, the National Precision Medicine Program, where they have reached out to the public to hear about the sentiments when it comes to sharing of data. I think in general, there is a high level of trust in terms of governments or ministry using the data for social value and public good. And so a lot of our time and our attention is really focused on building up the narrative and being able to demonstrate what we're doing all this for, and down to making and allowing every individual to see the value of what this is to themselves and also to the greater population. I think that really is the key.
In Australia, I think that the community is generally happy with the way data is shared and linked. We've had some wonderful champions over the years that have been able to showcase the value and the benefit from actually using linked data. But I think that we do need to be cautious because, as I said, attitudes can change. And we were looking at doing some more work with general practice data, but before we embarked on that pathway, we thought we would do the citizens' juries that were described at that link. And we were a little surprised to find that people were more cautious about their general practice data, possibly because they'd been to the GP more recently or there'd been some particular issue. And so that's given us pause for thought. And I think we can't make assumptions about what the community thinks, and that what they think now may be the same as they think going forward. So attitudes change, and I think it's important to keep a finger on the pulse. Having said that, I think that where there are particular cohort groups, so where there are patient cohorts, then generally speaking, people who are involved in those cohorts are very, very supportive, because they absolutely understand firsthand how research using health data can really benefit their family. So that's quite heartening, I think, when people really do have the information, then they can understand the value proposition, to use some jargon. But I think that we should never take things for granted, particularly as we have cybersecurity incidents and other things. For example, one of our big health insurers had a cybersecurity incident where a whole lot of data turned up on the dark web, and that then I think people feel concerned, and they probably don't know enough to distinguish this particular group from another group. So I think it's something that we need to keep front of mind and continue to work with.
Great. I've just got a couple of questions from our online colleagues. So a question for you both. When linking data on the platform, how have you tackled missing data, especially when public aren't keen on sharing certain aspects of their personal data or incorrect clinical data? So dealing with missing data, particularly in a linkage context.
Missing data?
Missing data, yeah. Or perhaps kind of inability to link some aspects of the data. Have you come across that challenge?
Well, it really depends on how clean and concordant your raw data is in the first place. I think definitely there will be certain instances where certain data elements are not available. It could be because at the data source itself. It could also be because when you're segmenting certain cohorts, some of this data are just naturally not collected as a result. What we try to do is really to engage researchers upfront and early to understand how and what they're thinking about doing their data, and then look at what is the best suggestions of the type of data that we could be using to counter that effect.
Probably from an Australian perspective, when you're linking data across the population, across numerous data sets, including births, deaths and marriages, there probably aren't a lot of missing people. There may be some missing data, but the benefit of the population linkage is that you know who the population is, and then you know if there is some parts of that data that's missing, then you can make some estimates. So I think that's probably a strong case for population data linkage.
And yes, and actually Kathy talks about the power of linkage quite a bit in addressing some of those challenges. And then another specific question, so this time about the trust platform in particular. Mingshi, can you expand a little bit more on what sort of social data it contains? So, for example, does it include welfare benefits, tax, employment, those sorts of other wider health-related data?
Yeah, so the social kind of data we're looking at could be housing data, could be education type of data. But I think at the end of the day, what is really important for us is what is the purpose of the project that the researcher is putting up for? Because it's a new platform, a lot of these conversations that we have with data custodians are also driven by the type of use cases that our researchers put up. So it's a continuous process. We have what we have now, but we want to continuously build up the data sets that's available, and really the ability for us to work with our researchers to be able to better appreciate the kind of data sets that's needed to drive some of this research helps us to really expand the type of availability of these data sets as well. Yeah.
Merran, have you explored those sort of linkages in Australia as well?
Well, I think probably because of our history, we don't have a separation between health data linkage and administrative data linkage. Probably because data linkage really started in the Australian states, who were responsible for a large amount of the hospital system and the education system and the families and justice and that sort of thing. So obviously with the social determinants of health from pretty well from the get-go, they were being brought in. So they're there, and then some of the data that the Commonwealth has, like benefits payments, it's also possible to bring that in.
Okay, fantastic. Oh, very last question, Andrew. I was about to wrap up, but you can get in quick at the end.
So, two great talks, and welcome to the UK, I should say. So, two questions. Firstly, can UK researchers access data in Singapore and Australia? And secondly, I could send both of you $100 within the next 10 minutes because our banks subscribe to SWIFT, IBAN, and BIC codes, and we can transact. Do you ever envisage a day when we can standardize the 5 safes across Singapore, Australia, and the UK, including Wales?
Merran, do you want to take that?
Well, I think standardising data is fundamentally important. I think we're still some way from doing that, but I think maybe we can look at that over a 5-year horizon and see what progress can be made. What was your first question again? Oh, whether you can access the data. That is a challenge, and what worries me is in the past the answer was yes, but increasingly sort of data sovereignty has moved beyond Indigenous data sovereignty to Australian data sovereignty, and suddenly governments thinking, well, this is ours and we need to hang on to it, which is something that we need to tackle going forward. So I don't think the answer to that's simple either. Certainly we will struggle to send data overseas. At the moment, people overseas can access data that's in a secure environment. But then, as I said, the Australian government's feeling a bit anxious about that.
The short answer is not yet in terms of access overseas. But I think for Singapore, it's not really a question of yes or no. It's really a question of how can we do this? Because, as I said, our population size is small. We do need to be able to do our analysis against a much larger population. Australia, UK, I think that's where the true power lies. I mean, we're just having a conversation with some of the HDR UK colleagues in the morning about how to standardize some of this as well. I think the conclusion we have really is that we all recognize about the need for data standards, but trying to boil the whole ocean is not the way to go. I think identifying specific use cases, specific projects, data elements, and get started from there, I think that's really the most practical way to get going.
Great. Well, out of time, unfortunately, but that's a really fantastic session. Hopefully we'll have you back in a year or two, and we might have started seeing some of this progress being achieved, but incredibly grateful for making the effort to come and join us here in Leeds today. Please join me in saying a big thank you.